Thank you, and good morning to all of you. Let me begin by a few recognitions of my own. I know that we had the introduction of our General Secretary Treasurer and our Executive Board through the video screens this morning. But I want to make sure that I recognize them as part of this incredible team that we've built that has really developed and created this incredible IAFF of all of ours. They are really the ones who take the ideas, consider the new initiatives. They're the ones who bring creativity and innovation into our work and to see it translated into the service and tools and resources that benefit and makes the difference in the lives of our members. I want to make sure that every one of you understand and fully appreciate the work they do, the leadership that they provide. And our trustees who make sure that this financial status of this IFF is sound and secure and transparent, and that invested your resources wisely, invested in your future, assuring each one of those dollars are cared for so carefully. And so from myself to my partner, my friend and my brother for 40 years, Tom, to our incredible executive board across 2 great countries, and to our 3 trustees, I just want to say thank you for your leadership. Thank you for all the work you do on our behalf of our 300,000 members. This conference is named after 2 leaders, John P. Redmond for our Health and Safety Conference, and Dominic Barbera for our EMS Conference. You know, when a number of us think back over not that many decades, 30 years ago, our profession was essentially a single service profession. Many locals and many departments having the vision and having implemented a fire-based EMS structure for years, but it wasn't the norm. So many of us entered the service thinking that all we were supposed to do and wanted to do was take a run and fight fires. And this international then began to understand the importance of EMS, not only to our nation and not only to the citizens that we serve, but to our departments and, most important, to the future of our members and our profession. To be able to secure that additional skill set, that raises them up. And it took a vision to really push this IAFF in that direction. Initially resistant, initially controversial, but ultimately finding our way to recognize the power and the importance of a fire-based EMS integrated fire service. And the person for who that part of the conference is named for is really the father of that idea within this IFF. The leader who was willing to stand up and speak out and push us and force us to begin to recognize how important this would be to our future, to the point that we embraced it by policy, ultimately, as the policy of the IFF to establish fire-based, integrated, dual-role EMS into our ranks. And that person's with us today, a great leader in so many ways, serving this international as a local officer, an international vice president, but most importantly, bringing this vision forward that's helped to build our profession into what it is today. And so it's to you, my brother, Dominic Barbera. We are thankful for your leadership, your vision, and we are thankful you're here with us today. Brother Barbera, please stand. I also want to extend a welcome to several of our global partners. We're joined here this week by our brothers from the United Kingdom, the Fire Brigades Union of the UK, the United Firefighters Union of Australia, and the New Zealand Professional Firefighters Union that, as all of you are doing their work to make the difference in the lives of their members and to advance their profession. We've had an extraordinary relationship over many years. We're finding more and more ways to collaborate, to share information. We're going to continue to build on that. I know they're in the room, but please, to our global, international guests, and more importantly, union brothers that are here, thank you for being here with us, and thank you for all you do. I also want to just quickly recognize Saturday will be 10 years. 10 years since Hurricane Katrina destroyed our Gulf Coast, and then followed by Hurricanes Rita and Wilma, which devastated so much of the Texas coast and Florida. But not only in recognizing that extraordinary storm and disaster of 10 years ago, but to recognize again the service and the response of this IAFF. It responded while our members remained on the front lines. No badges thrown on the desk for many firefighters across that region. And while they're on the front line, so many of them losing all of their personal lives, their homes, their families devastated, their families having to move out of the area. But this IAFF responded while they were handling their response, to make sure we set up headquarters, to make sure that we brought in food, that we brought in clothing and water and medicine, to provide financial assistance to those families literally blown out of their homes. And so I am so proud as I think back, and our brothers all across that region who responded and their incredible work that will always be remembered, to also remember the work that you did, the work that this IAFF did to help secure the health, the safety, and the wellness of our members. That's what this IAFF is all about, and that's the kind of work we're going to continue to do. Let's remember those from 10 years ago. And for those, and I'd be remiss if I didn't also recognize the extraordinary wildfire season that is now underway all across the West, from Alaska all the way through California and certainly beyond. We have thousands and thousands of our members who are on those fire lines. They are on the front line. They're doing tough duty in a tough environment. We're going to spend part of this conference to find out how we can better understand the complexities of this new firefighting world where WUI, the wildland urban interface, now resides and continues to grow. But I just want all of us to please remember that they really have their hands full. They're doing incredible work. They're making all of us proud. I want to make sure we all wish and pray that they stay safe in the extraordinary service they're providing out there this week. God bless them. For 98 years, working on behalf of our members, this IAFF has been committed to excellence. We've been doing it not just by focusing on bargaining rights and enhancing members' wages and benefits, and fighting for quality health care and pensions for them and their families. No, we've been doing it by being strongly committed to protecting their safety, their health, by focusing on raising those national standards that set the benchmark for this great profession of ours, by building programs that literally save our members' lives, and by improving their skills, expanding their work to respond to all hazards, increasing their value to the communities that they serve, so that we can demand more for them and for the service that they provide. And it is part of our commitment to excellence that has truly put this union on the map as a force to keep our members alive and well. A force in working with the organizations that set the standards, establish the codes in the United States and Canada. A force to be reckoned with in the halls of Capitol Hill and Parliament Hill. A force in the state and the provincial houses where the laws are made, where the administrations that occupy the White House and 24 Sussex, and the governors and premiers across two great countries who support or oppose, interpret, and enforce the laws that make the difference in our members' lives and livelihood. To me, it is our commitment to excellence, the resources we dedicate, the expertise we have created, the scientific evidence that we pursue, the data we use that sets us apart from most other unions. Because working together, each and every one of us, every one of you out on this floor today, working tirelessly, fighting every single day, no matter how many dark forces do battle with us out there, we're doing our work at every level of this IAFF to safeguard our members' lives, to enhance their value to their communities, and to improve the public's safety. And along with the great work all of you are doing all across this international, the tremendous work that your IAFF has developed, produced, delivered, taught, has been created by nothing less than the most extraordinary staff any organization could ever hope to have. A staff that delivers quality at the highest level. Whether it's the work you'll be engaged in this week, prepared by our Health and Safety Division and our EMS department operations, or whether it's our communication and public relations, whether it's our government affairs and political division, the extraordinary technical assistance and pension capabilities, a strong and experienced legal team, education and instruction delivery of the highest caliber, hazmat, WMD, and grant administration that trains our members for the worst and saves their jobs. Canadian Affairs servicing all of Canada, a budget and administrative team that has brought in great innovation and transparency, a successful financial corporation that you all own, in addition to your own media production team and a broadcast studio, and the dedicated professionals of your charitable foundation. This is your IAFF. Brought to you by your incredible IAFF staff. And with that staff in the room and here, please stand and receive the applause that you so richly deserve. As we begin our critical work this week, I want to remind you that every one of us here today, and you've heard me say it before, we all started our journey when we took that first oath. Typically young men and women in our 20s who somehow found our way to this incredible profession we call the job. You committed literally your lives to be there for the citizens of our respective countries in their times of terrible tragedy and greatest need. And then every one of you here today also chose to take that second journey that so many of us take, to offer up yourselves on behalf of your brothers and sisters on your job, to try to make a positive difference in their lives, to fight against injustice on their behalf, to advance an agenda to improve their health and safety. That second journey has brought you here this week because you not only believe in strong public safety, but because you believe that protecting those in our ranks who lay it on the line every single shift is an even higher calling. Because you believe and understand that the work firefighters and paramedics do 24/7, 365 days of the year is not like that of any other profession, because it's the work that you've also done. Because you believe the job our members have signed up for is more dangerous. And it is more stressful and more traumatic and requires a true diversity of skills just to survive, just to make it to the end of that shift so they can go home to their families. That's why we're here this week. That's why we've all gathered in this hall and in the breakout rooms for the balance of this week. That's why this union of ours, this great IFF, is truly committed to excellence. It's why we are committed to giving you the latest information on keeping our members safe on the job. It's why we're looking for tomorrow's new opportunities to enhance their profession by expanding emergency service and the role our members are entrusted to do, making them more indispensable to communities and the citizens they serve. And it's why we are here to discuss the most up-to-date research, the latest studies on fireground operations, the best practices in behavioral health services. I can make a commitment to every one of you, and I know you'll make a commitment to each one of us. And that is, we are not going to stand silently, and we're not going to allow elected officials or ill-advised command to ignore our members' health or impose standards and staffing reductions that jeopardize their safety. We're not going to do it on my watch. I know you're not going to do it on your watch. And if they choose to put our own in harm's way, then we're prepared to put the bastards out to the pasture. This week, this work is part of our strategy to keep our incredible membership not only alive, but to keep them well through a long career. And then so they can enjoy that retirement that every single one of them earns with their service and sacrifice. And as we're approaching the 100th year anniversary of our extraordinary and great union, I am proud to say we continue to innovate, we continue to create, and we're continuing to make great progress. From the quality of the clothing on our members' backs and the gear and equipment they use, to the air they breathe, to the apparatus they ride, to the level of skills required to competently respond to the dangerous calls they take on every day. We're making a difference. We're achieving our goals. The undisputed fact is that this union's been at the forefront of every health, safety, and EMS development in the fire service over the past many decades. It's your IAFF and you that continues to push the envelope on NFPA standards for training, PPE, apparatus safety. It is this IAFF that formulated, built a coalition around, and created the Wellness Fitness Initiative, ensuring our members' health is monitored and tracked throughout their careers, helping lower the death rate from heart attacks and stroke where it's been implemented, and pushing every single day to prevent the cancers that take so many of our members' lives too early each year, including the 194 that we'll place on the walls of our new fallen firefighter memorial next month in Colorado Springs. It is this union that created the Candidate Physical Ability Test, CPAT, that makes sure that those who want to enter our profession, who want to come on the job, are prepared for and capable of the physical rigors of the job. It is this union that took the mantle of fire-based EMS, utilizing the strength of our response networks and know-how, and carried it forward from the early pioneers, expanding the expertise of our members while improving the public safety. And it is your union that in 2001 took a stand for NFPA 1710 when it was under extraordinary attack. And we came together, we marched together into that annual conference in Anaheim, California. We were 2,500 strong, and what we did was to ensure that the standard was adopted that sets the benchmark today for how department staff and deploy their response to on all kinds of calls. We prevailed, and we did it as a great union. We did it together. And it's been, yes, you did it. 2,500 of you. And it has been this union that's led the way in pushing for the research and studies that have provided us with the scientific evidence that is now included in the most recent revisions to 1710, forcing command to make operational decisions that accurately match staffing and resource deployment to the risk levels in the neighborhoods and the cities our members serve, and at the same time improving their safety. And I could go on listing the accomplishments and the incredible advances we've built today, but instead I want to turn to the latest innovations that we're working on, and that so many of you in this room have had a critical hand in moving forward. The programs and services we've recently been delivering, the new initiatives which are developing today as we're meeting here this week with your input, with your expertise. And don't worry, I'm just not going to go on in great detail here from the podium, because we do have over 95 workshops where we'll discuss much of this week. That will include literally hundreds of hours of instructions, sessions that will detail and provide you with access to the industry's top experts and the latest updates to our peer fitness training initiative. You'll hear the latest, our partnership with NIST and other fire service leaders on fireground operations, fire behavior, EMS delivery. You'll hear what we've been working on to improve building codes and NFPA standards. You'll be able to go through and learn how to gain access to our fireground survival program, including the new and expanding mobile unit delivery system, the first comprehensive survival program of its kind that gives our members the skills they need to save themselves when everything goes to crap and they encounter a mayday, a situation on the fireground where too often our own who are skilled in rescuing others may not be as skilled as they should to take care of themselves. You'll get hands-on access to the latest developments in active shooter and community paramedic protocols, and hear the most up-to-date information surrounding our efforts in cancer research and expanding the presumption laws that our members are entitled to and they deserve. And this week, you'll get a glimpse into the future with our latest data project, Fire Cares, which builds on our successful GIS studies with new multiple layers of big census, health, and vertical analytical data that'll give you powerful multidimensional reports and tools to fight against staffing reductions, company closings, brownouts, stations being shuttered, while also improving the safety of your community. And over the next few days, we'll take the time to go into depth on critical topics like how we can bring out of the shadows and ramp up our awareness and assistance for our members with post-traumatic stress. This is a condition that is nothing less than at epidemic levels. You know, I guess it's been with us a long time. Maybe not recognized, maybe not accepted, maybe those dealing with it not prepared to come out of the shadow. But the fact is that our members are dealing with a lot, and probably so many of you may be right in this room, and dealing with it right in here. And they stuff it down, and they cover it up, typically with firehouse humor. We know that we've got to bring this behavioral health issue out of that darkness and out of the shadows. You know, many of your states, I think I made 37 states and provinces, and you heard me say that one magazine earlier this year with the cover of the firefighter kind of in the shadows, it was meant to be a powerful view to take you into a very powerful story about what's occurring. What we had no idea and didn't realize was exactly the power of that magazine, because the phone lines at the IFF blew up. And they blew up with our members calling in. I'm in trouble. I'm hurting. I don't want anybody to know who I am. I don't want anybody on my job to know I've called you. I don't know where to go. I'm afraid if I come forward, I'll lose my job. I don't want to be overly dramatic. We had them on the phone telling us they were prepared to take their own life. I don't have to tell you, cities, counties, towns, ridings, that our members are dealing with this condition and hurting enough that more and more they're willing to bring harm to themselves. We're experiencing suicide rates 6 times higher than the general population. And yet we're dealing in a profession that sometimes inadvertently places a stigma on certain conditions or stereotypes them. And we've got to dispel that. And we've got to put in the protocols that gives our members the comfort and confidence that they can come forward. Now, we got to be able to provide them with the diagnosis and the treatment that is available. We got to make sure that we can assure them that by dealing with this, they're not going to necessarily or immediately lose their job. And we've got to make sure that we get the governments all across 2 countries to recognize that this condition is a job-related condition, and our members, are entitled to all the protections, the benefits, and the retirement provisions that covers other occupational disease. That's the work this union is focused on. And that's the work that we're making our investment in and expending our resources toward. That's our commitment to excellence going forward. And that's what you will leave here with. So as a leader of this union on behalf of a great profession, you do have the knowledge, the tools, the expertise behind you to challenge those in state and provincial houses, city and county administrations, and command to make the right choices in protecting our members' jobs and their lives. You will hear with the knowledge that you leave here with the knowledge that you will need to take on the decision makers back home, to change your SOPs where they need to be changed, to make sure that jurisdiction's in full compliance with 1710, like our affiliates have done in Chicago and Houston, and Phoenix and Indianapolis and San Francisco and Milwaukee and so many other cities. So you can go home and convince your chief officers to bring our innovative, completely self-contained fireground survival program to your department, like our leadership in Bridgeport, Connecticut, Honolulu, Calgary, across all of New Hampshire, and so many others who have done so. And so you can press for the adoption of a full wellness fitness initiative and its protocols, which have the capacity to save more of our members' lives than we ever imagined, like we're doing in Austin and Calgary and Fairfax County and Los Angeles County, Port Moody, British Columbia, Lewiston, Maine, and right here in Prince George's County, Maryland, where we're meeting today. And so you have the facts you need to begin working to implement a community paramedicine, or mobile integrated healthcare program in your communities to add that value to the service our members provide to the public, like our affiliates are doing now in Mesa and Chandler, Arizona, and Alameda City, California, and Dallas, Texas. And so you can develop those PDS model programs, like the incredible peer counseling unit in New York City, or like in Philadelphia, where Local 22, they didn't wait for the city to do something. They just got to work and developed a program with Drexel University to take care of our members there. Like they stepped up in Seattle, where our leadership made sure our members have 24-hour access to help. In Ottawa, where our local is using the train-the-trainer format to educate their members. And in Winnipeg, where their new communication platforms are informing their members and their public. And in Oxnard, California, where our local grew impatient. They were tired of waiting with the city's lack of response and applied for a grant on the city's behalf. And they're now providing peer counseling training to their members there. And we need to also push to make sure our members who are dealing with post-traumatic stress are going to be covered in every way by their health care systems, by their retirement plans, by their disability plans, That condition needs to be covered, just like our leadership in British Columbia, Alberta, Manitoba have done, and in Connecticut and Colorado, where they're currently advancing bills through their respective legislatures. And there's so many others that I could mention. Now, those are big tasks. But I also know that each and every one of you is up to the challenge. But before we go into those breakouts and workshops and sessions that will detail all of what I just talked about, the one thing I want to make sure to remind each and every one of you, to remind us all, is how this union actually gets all of this work done at every level. And I couldn't have had a better lead-in than to listen to County Executive Baker not talk about his government, but to talk about our leadership here, to talk about the importance of the political arena, to talk about how Local 1619 stepped up to the plate, first in, which is one of our core principles, and elected an official who then was willing to step up and make that difference on our behalf, to embrace that agenda of ours. We need to continue to remember and remain steadfast in the process that ultimately determines everything that gets decided about our members' jobs, their lives, our entire society, our nations. Not just how we get their wages boosted, their health care benefits expanded, and their pensions secured, but how we truly make their jobs safer, more secure, ensure their health is looked after throughout their careers. How we can change the way EMS is handled to improve service and delivery and expand our members' roles and values and generate new revenue streams to your departments. How we can get that presumption coverage expanded more and more and more and more states and provinces. And the ultimate and only way we're able to do all of that is by playing in that political arena. We've embraced it over these many, many years. We know we got to be in, even when we know that many of our members on our jobs don't quite believe that that may be the fact, especially among so many who consider themselves to be apolitical. But the simple fact is that what we have built to date, and in order to get the things implemented that we will discuss here this week, we have to convince either an elected official or someone appointed by an elected leader to get it done. That's how it works. That's who has the power. That's who has the authority. And what we have is our political ability. What we have, and even though it's an inconvenient truth, is that this union knows how to take seriously and has done so for so long, and as long as I've been privileged to be a part of it, and as long as you've privileged me and given me this opportunity for 15 years to be your general president, that what we've got to do is to make sure that we are on our game when the political elections and decisions are made. And it's why we focus on and invest so much effort and resources in our political operations and our gold and black brand. And it's why in the coming federal election in Canada and in the 2016 elections in the United States, this union is going to be in that game. And we're going to be playing to win. And because our members deserve no less, even sometimes in the face of their own individual and personal adversity, if you will, on what we're trying to do for them. That's what we're all sworn to do on their behalf. If we don't want to get ourselves in trouble, and if we don't want them to be angry, I guess we should just step out and leave it to others. They'll make the decisions and we got to live with the results. Well, no, that's not what we're going to do, and that's not what we ever do. We're going to be in that arena, and we're going to make sure that we're there to make the difference and to hold those that receive the support of this IFF and you and hold them accountable. It's why we are here this week, and it's what we're going to continue to do together. So now, it's time to get to work. And I want to wish you a great week, and I hope you have a great 2015 Health and Safety and EMS Conference. And I want to simply say, God bless you for what you do. And God bless every one of our members on the front lines everywhere. Thank you.